I'm Dr. Salvatore Petta. I'm a gastroenterologist working at the section of gastroenterology at the University of Palermo in Italy. In this video, I will discuss a paper titled Hepatitis C virus infection is associated with increased cardiovascular mortality, a meta-analysis of observational studies. Hepatitis C virus infection is a leading cause of morbidity and mortality worldwide, and the genesis of this study goes back from the evidence that this infection does not affect only the liver, but it's also able to produce extrahepatic complications. It is well known that HIV-infected individuals have a higher risk of immune-related disorders including lymphoma. In addition, literature data clearly showed that HIV-infected subjects have a higher prevalence of metabolic alterations like fat liver infiltration and diabetes due to the already demonstrated ability of the virus to interfere with lipid metabolism and insulin signaling. In this complex and biologically interesting picture, some recent studies suggest that this infection can also increase cardiovascular risk. However, the results of the studies are sometimes contrasting and inconsistent, and the overall impact of HIV infection on cardiovascular morbidity and mortality is difficult to evaluate. Having this in mind, we planned to perform a meta-analysis to estimate whether HIV infection is associated with an increased cardiovascular risk. For this purpose, we did a careful electronic search from the major literature sources, and we included in the meta-analysis 22 studies comparing the prevalence of the occurrence of cardiovascular disease among HIV-infected individuals and uninfected controls. The main outcomes of this meta-analysis were the risk of carotid atherosclerosis, of cerebral cardiovascular events, and obviously of cardiovascular mortality. This meta-analysis, to our knowledge, for the first time clearly highlights that HIV-infected individuals have a higher risk of cardiovascular mortality, even if with some heterogeneity among studies. The meta-analysis also reported a twofold higher risk of subclinical atherosclerosis among the HIV-infected subjects compared to an infected control, without significant heterogeneity among studies. Looking at the cerebral cardiovascular events, we evaluated a lot of studies, and we found a significant higher risk of these events in HIV-infected subjects compared to an infected control, also confirming these results when considering separatory cardiovascular and cerebrovascular events. However, as expected, we found a high heterogeneity among studies. So, to explain this heterogeneity and consistent with the meta-regression results, we performed subgroup analysis showing that the risk related to HIV infection remained significant in populations at higher prevalence of cardiovascular risk factors like hypertension or diabetes. In conclusion, from a clinical standpoint, our meta-analysis suggests that HIV infection increases cardiovascular risk, particularly for individuals who already have cardiovascular risk factors like diabetes or hypertension, so suggesting a careful cardiovascular assessment in these populations. In addition, our meta-analysis, together with the availability of two safe and very effective interferon-free regimens for the treatment of HIV infection, suggested the need of prospective studies assessing the impact of HIV eradication on cardiovascular outcome, as suggested by preliminary and retrospective studies.